that that artery is blocked, no more blood can get past it. And when no more blood can get past it, it starts to back up. And when it starts to back up, that's the chest pain. You talk to somebody having a heart attack and they go, what does the pressure feel like? It says, it feels like a heavy pressure sitting in my chest. This is true. What does the pressure in your chest feel like? They would say, it feels like an elephant is sitting on my chest. Or it feels like a hippo is sitting on my chest. The question wasn't what 2-ton zoo animal feels like it's sitting on your chest. We would just say, what does that pressure feel like? And they pick big, heavy objects. Hippo, I heard a bunch. Elephant, I heard a bunch. Semi-truck, I heard a bunch. Now, those are all descriptions for what that pressure on their chest feels like. I can't imagine how bad that pressure on their chest feels if they're picking hippos and stuff like that. So, anybody with chest pain, we want them to sit down if they can, okay? They're not going to lay down for you if they're conscious, because if they lay down, they have trouble breathing. They don't want to breathe. So, they'll sit for you or they'll stand. The very, very common position people would be in when we got there was tripoding like this. Because this gave them the most air. They would tripod like that and breathe like that. There was anxiety and so much anxiousness. You know, they call 911 and we pull up in the fire truck and they're meeting us on the street saying, let's go. Well, we got to wait for the ambulance. Sit down. We'd sit them down or try and sit them down on the back of the tailboard and do our assessment out there. But they were ready to go. Let's go. Let's go. So what do we do for them? If they're not allergic to aspirin, have them choose some aspirin. 4 babies or 2 regulars. Aspirin thins the blood. If they have a history of heart issues, they have a pill called nitroglycerin, or they've been given a pill called nitroglycerin. What nitro does is it takes that occluded artery, and when they put the nitro under their tongue and it gets absorbed into the bloodstream, it takes that artery and it opens it up into a big fat pipe. And so what happens is, here it's so small, all the blood is backed up. And so the nitro opens it up and then the blood goes through. So if they've been diagnosed with angina, they're given a pill called nitroglycerin and they're told to take it when they feel chest pain. So half the time these guys don't even call 911 anymore because they stop doing whatever it is that was causing the pressure, and then they put the nitro under their tongue and then their arteries get bigger and the pain goes away and they go on with the rest of their day. But anybody who's feeling that kind of chest pain for the first time, or feeling it and not taking it without the nitro, they're calling 911. We have them chew the aspirin if they're not allergic, because that's going to thin the blood. And so that doesn't open the artery, that just hopes that thinner blood will get past the occlusion. And then if they have the nitro, the two together are going to open that up and help them. 911, do not drive somebody who's having chest pain to the hospital. Do not. My brother's ex-wife, my ex-sister-in-law, lived in Portland. She was having chest pain. She had my niece, her daughter, driving her to the hospital, and halfway to the hospital, she dropped dead, cardiac arrest right in the car. My niece pulled over, pulled her out of the car on the side of the road, started doing CPR on her. She did not survive. Now, she was going to have a heart attack regardless. It didn't matter whether she was in my niece's car or not. But the difference was, if she would have been in an ambulance, she would have been with a paramedic, and with the paramedic, they would have had the drugs and the tools to possibly save her life. But they didn't have that ability because she wasn't in that environment. So call 911. Chest pain. Don't drive anyone to the hospital with chest pain. 911. If we walk into somebody's house, we, the fire department, which I'm not anymore, but when I was part of that, and we would walk into somebody's house, if this was a heart attack, we did some paramedicine right in their bedroom or their living room. We would hook them an IV. We would start putting drugs or fluids into their body. We would give them medication and nitro and aspirin. We would treat them, hook them up to an EKG, and we would watch that stuff going on and see how the drugs that we were giving them affected that. So we would do about a 10-minute assessment with another 10 minutes of drugs and stuff before we would put them in the ambulance and take them to the hospital. Sometimes it took us 25 minutes to get them back into the ambulance. Now, a stroke would be a different story, because a stroke is a bleed in the brain. Now, here's a little thing that it doesn't make sense to me, so I want to make a point of it. A stroke gives you a very bad headache. It's a bleed on one side of your brain or the other. If the bleed is on this side of their brain, it affects this side of their body. And you'll see their eyes droop and their mouth droop, and it's hard to talk when half your face don't work. So if I see droopage of any side, okay, what I'm going to ask them to do is smile for me. Would you give me a big smile? And half your face will go up and half your face won't. If that's what I get, I'm going to put my fingers in their palms. I'm going to say, squeeze my fingers as hard as I can. The side that smiles squeezes, and the side that did doesn't. Does that make sense? If that's what I get, I put them in that ready position that we talked about, the affected side down, and I call 911, and immediately tell 911, I believe this person's having a stroke. They're going to say, why do you think that? Their face is droopy, they're having trouble talking, they're drooling. The reason we want that to be known from the fire department perspective and the ambulance perspective, we're not doing anything on the ground when we get there. We're putting them on a gurney, we're putting them in the back of the ambulance, and we're sending them to the nearest stroke center. It's now a race to get this thrombosis drug into their blood. These drugs now will clear the clot, and people are surviving these things. If you think about my grandfather's generation, the stroke killed him. He had no chance. And then in my dad's generation, they figured out how to keep him alive. But the problem was, if the stroke didn't kill him, they were paralyzed for the rest of their life, and they had to spend the rest of their life in a care facility. Now, if we recognize a stroke and get them to a stroke center within 90 minutes of onset, they have this thrombosis drug that blows the clot out, and these guys are back to work in 3 weeks now. The same stroke that killed my grandfather's generation and put my father's generation out of duty forever, now, if we recognize it soon enough and get them to the stroke center, they go back and live a normal life. Maybe a few deficits depending on how long they went without oxygen in their face, but it's not near what it was. So anyone slurring their speech, anyone that's you're able to use their 911 and tell them it's a stroke. You think it's a stroke. And then they're going to come and do the assessment, and at the end of the assessment, they're going to get that guy to the hospital as soon as possible.